Hey, this is Brandon with ChiroUp. Let's go through the perfect marriage between an orthopedic test and a functional test. We're going to start off with a three-phase hyperextension test, which is also called Manel's test, and we're going to learn where someone's having their problem. Then we're going to get into the hip extension knee flexion test to find out why that person's having that problem. Let's start off with the three-phase hyperextension test. I'm going to bring my patient into hip extension and I'm going to do it with three different pressures. The first one's going to be on their pelvis, blocking the SI joints on both sides. As I bring his hip up into extension, I'm looking for reproduction of pain in the front part of their hip, indicating probably hip pathology or tight hip flexors. I can then move over and be parallel with the SI joint and now bring the hip up into extension. Now I'm shearing the SI joint. If I get reproduction of pain along the SI joint, I'm looking at SI joint pathology and possible restriction. I can now move into the lumbar spine, block the lower lumbar spine, and bring his hip up into extension, looking for reproduction of pain at the lower back. Now there's different variations of that test, but really what we're looking for is as we move our hip up into extension, what happens? What tissue is being overloaded? Because we need hip extension for explosive maneuvers like running, like jumping. And if we don't have good hip extension, bad things happen, bad compensations happen. So now we can mirror that to the hip extension knee flexion test. This test is looking to see why that test could be positive. So what I'm going to have my patient do is they're going to flex their knee to 90 degrees and he's going to hold it right here. I'm going to have him flex both glutes. He's going to contract his glutes, and I'm going to palpate those glutes, making sure he maintains contraction. And now he's going to bring his knee off the table. As you can see here, does a really good job. No real compensations here, and back down. But now let's show you the compensations that he might have. So as a patient goes to do that, there are many things that tend to happen. The first is he's going to actually go through a loss of glute contraction. I mean, he can't keep his glutes contracted for that long because there's some weakness. We can go into hip strengthening exercise with him. I also have increased lumbar spine extension. So as he brings his glute up, he gets hyperextension in his back. He doesn't have enough strength in his glutes. He's going to use lumbar spine erectors, and unfortunately, lumbar spine is going to pay the price there. We also have increased distance or rolling up of the anterior superior iliac spine. So when he picks his knee up, he's going to roll towards the camera in this situation. He's using those contralateral quadratus lumborum and trunk rotators, which would be a compensation. And then finally, we look for his actual compensations. A lot of patients don't have enough strength in their glutes or their hip extenders, and they need help from those external rotators. So as he tries to pick up his leg, you're going to see external rotation of the hip. Or we see abduction of the hip. So as he picks up, he doesn't have enough strength and he recruits that tensor fascia lata on the outside, leading to diagnoses like IT band syndrome. If I see any one of those compensations, I need to be thinking to myself, this person has a pain or a problem, and he is showing me his compensation. I can go ahead and attack that with my treatment and manual therapy, manipulation, and most importantly, going into my at-home rehab and going into increasing hip extension with the exercise shown at the bottom of the blog, or going into hip strengthening if he can't maintain that contraction or perform this orthopedic test properly. I hope this helps in your assessment and also your evaluation, because what we know is that if he shows these compensations, he has an increased risk for posterior chain injuries. That's your hamstring injuries, that's your calf injuries, that's your lower back pain. We need to prevent these athletes from getting these diagnoses later on in their season, and hopefully we can do it in the preseason and prevent them from having a season-ending injury. I hope this helps. If you have any questions or concerns or comments, please email me, Brandon@chiroup.com.